Hi, I'm Dr. Lauken, and I'm going to talk about when might more breast imaging be helpful after a person has had a lumpectomy for breast cancer, but before they've had radiation treatment. Thanks for joining me. So, whenever a person has a breast cancer that's removed with lumpectomy, a tissue specimen will be sent to the lab. And the goal is that that piece of tissue contains the cancer and that there's no cancer at the edge. And hopefully, there's no visible cancer left in the breast around the place where the cancer's been removed. And when that specimen goes to the lab, it's checked for where is the tumor, how big is it, how close is it to the edge, and is there just one spot or are there other spots that are right in the neighborhood? And the pathologists are able to give us a general idea as to whether there's an arrangement of many little areas or, say, just one. And one can compare that to what the imaging tests showed before the surgery. And here's a couple of examples. On the left, we have the most straightforward. There's an area of cancer in the middle of the specimen. And on the right, we have a situation where, yes, there's an area of cancer in the middle of the specimen, but there's another little focus that's nearby. Or we can take this yet further. This time, on the left, there's uh, the obvious cancer in the middle, and there's two little other areas of cancer. One's right in the uh, segment, and the other is right at the edge, you can see at the top. And on the picture on the right, you see that, yes, there's the obvious cancer in the middle, but now there are lots of little additional areas of cancer that are, if you will, sprinkled throughout the specimen that's been removed. And perhaps none of those were evident on imaging. They were totally unsuspected and just found by the pathologist looking through the microscope. And if we think about why would we care, and it's what if there's something on the other side of the margin? So if you have a bunch of little spots and you've been removed, how do you know, as we see in that picture on the right, how do you know that there aren't a number of neighboring little spots just on the outside of the area that's removed? So those spots would be left inside. Or if it's right at the edge, just like the one on the left side, uh, that might be all there is, that there really isn't anything on the other side. So what might we do to check the remaining breast tissue? When should we be doing that? And so as you might gather, if when the pathologist looks at the material that's been removed and says, look, there are areas of cancer that are away from the main spot, and particularly those weren't seen on earlier studies like mammograms and ultrasounds. And especially if some of those little areas of cancer are very close to the edge or the so-called surgical margins, or if they're close to many edges, top, bottom, sides, and so on, those all raise in our minds the desire to be as sure as possible that there isn't anything, if you will, lurking and hidden in the remaining breast tissue that's right around the area where the surgery has been done, or possibly even further afield. And so our goal is to check. So we know, looking at the picture on the right, that there's going to be uh, signs on any test that we do that a lumpectomy has been done. There'll be some scar tissue or a cavity. But what we want to find out is, are there other little spots, like those little dots that you see around that cavity on that picture on the right? And an MRI of the breast can sometimes give helpful clues. Here's one example of an MRI that shows those brighter dots. Those are suggesting that there might be small remaining areas of cancer in the ducts that weren't suspected at the time of surgery. And the hint that they might be there came from the pathologist who said, gosh, I can see lots of little bits of cancer around the obvious spot. So maybe there are going to be some little bits elsewhere. On the other hand, sometimes one can look and there's nothing worrisome at all. This picture might look kind of startling where you see that thing that looks raggedy, but that's just what a lumpectomy site would look like. And importantly, there aren't other little worrisome dots around it. There's just the area where the surgery has been done. So just to summarize, sometimes extra tests like an MRI can be helpful to help understand uh, better the question of is the obvious cancer all removed? And so we might regard additional tests as a way of dotting the I's and crossing the T's. And depending what we find, sometimes it can be helpful to even think about going back and taking another little edge just to be sure, or else saying, gosh, this looks really reassuring. We can just press on with the radiation treatment that we had originally been thinking of. So thanks very much for your attention.